I've heard people say that the issue around accountability and delegation is a really complicated, difficult concept. It's not. It's all about doing what's best for the patient. That's why this is really important. So if we focus on that, it creates a much safer environment for us to care for people in any setting.
Patient come into the surgery for fasting bloods and a blood pressure check, and he had a psori. It was inflamed and red and a bit swollen. He asked me if I could take a little look while he was here. It did look a bit red and inflamed, and he needed to be seen by the practice nurse, and unfortunately she had a full clinic and extra few for triaging that morning, so I'd need to book him in later that day. He was a little bit annoyed. He said, well, why isn't there a practice nurse here this morning? I thought you was a nurse. And I said, no, I'm an assistant practitioner. I'm not a registered nurse. He wasn't very happy about that. He just wanted me to put some cream and some dressing, he said, on there. And I explained to him it wasn't that simple. He did put a lot of pressure on me to try and get it sorted there and then. It does make you feel very frustrated and a little bit incompetent in front of the patient when you say, I can't do that. Obviously, with him being a bit agitated about having to come back to the surgery, I was a bit worried that if he didn't come back, it could have got worse. It could have turned into an infection. We would have needed to have given him medication as well as dressings, so it could have turned into quite nasty consequences for him.
Pretty fundamentally, the role of assessment lies with the registered nurse. Healthcare assistants must ask themselves, do I have the authority from my employer to undertake this task? One of the most important competencies is to know the limits of your competence. So it's very important that you know when you've reached a point when you're caring for a patient that you now don't know what to do.
Put under that kind of pressure by patients in the moment when they're saying, look, just do it and I need to go and I'm not coming back. She needs to say no, and she needs to be confident to say no. If we look at our own behaviour, there are drivers within us sometimes, like the need to be liked, the need to be seen as being competent. If I don't do it, they won't like me. And you need to disconnect those two things. When a healthcare assistant accepts responsibility to undertake a role or a task, they become accountable for that task.
I think the healthcare assistant needs to be very, very careful, but also obviously support the patient. Reassure the patient and say, I'm not in a position to make an assessment of your wound and advise you on any treatment. I'm really sorry. Actually, although this decision is inconvenient for him, he's got his safety at heart. As well as the healthcare assistant reporting that to a staff nurse or sister as soon as possible, she would need to make a note in the patient record to say the conversation that happened and then any advice that she gave him.
I've been a HCA for almost a year now. Within the recovery area, you have to take blood pressures and all the vital signs of the patient after they've come out from the procedure room. With my NVQ level 2, one of the things we have to cover is taking blood pressures and vital signs. I had asked the registered nurse if I could take these blood pressures and if I could be observed. I felt I was confident enough to do it, but she didn't allow me to do it, which was slightly frustrating because part of the learning curve is to actually do what you are learning. I felt slightly deflated. I realised how busy it was at the time, and I realised how much she was doing as a registered nurse and how much pressure she was under. They are a lot more experienced, whereas I am only just starting off in that area. But it does get frustrating when you get told you can't do it. It's very demoralising.
The most important thing I would say about delegation and accountability is patient safety. He needs to approach the staff nurse or sister, and as part of his development, good practice in any ward or department would be to have a conversation about your training needs. It's really, really important to have a record of the learning that you've undertaken and achieved, so the evidence is there. They might be worried that the staff nurse would think they're speaking out of turn, or that they're silly and they don't understand what they should be doing. All been student nurses, all been junior staff nurses, we should all still understand what it's like and have some empathy towards our colleagues and be seeking to support them, because actually that's how you get the best out of people.
Sometimes there's confusion between registered nurses and healthcare assistants about accountability. The registered nurse is accountable for the process of delegation, so they need to make sure that they follow the steps. Is it in the best interest of the patient? Is the person they're delegating the task to competent? Have there's written evidence of competence assessment? Has there been education and training? Is there supervision and mentorship in place? What's the risk assessment? You know, you have a responsibility as a registered nurse for making sure the care has been delivered. If all of those things have been done, when the registered nurse delegates the task and the healthcare assistant says, yes, I feel confident and competent to do this, you're giving me the authority by delegating it to me, I'm accepting the responsibility, then when that happens, the healthcare assistant is accountable for their own actions.
It's important for all healthcare workers to understand who they're accountable to. They're obviously answerable to the most important person, that's the patient, and that accountability lies via the civil and criminal legal systems. They're accountable to their employer via their contract. They must follow procedures and protocols and only undertake the duties that their employer gives them authority to do. Registered nurses have the additional line of accountability to their professional regulatory body. So for nurses and midwives, that's the Nursing Midwifery Council.
My advice to healthcare assistants who are being asked to do too much is they absolutely need to raise it as an issue, because it will absolutely affect the standard of care that they provide. They're more liable to make mistakes, and it's really important for healthcare assistants to know that if they do something without the education training, without having the competence assessed and whatever, they will be held in law accountable for their actions.
There are currently no national guidelines on what a healthcare support worker can do. Registered nurses are accountable for, first of all, making the decision to delegate to a healthcare assistant. When they make that decision, they are stating that the healthcare assistant is competent and has current competence. If that is the case, when the healthcare assistant undertakes the task, they then are accountable for the consequences of undertaking that task.
At the moment, healthcare assistants are not regulated, so there is no body that they report to. It might be quite right that there are different roles assigned to different healthcare assistants based on experience, competence, whatever grade or band they're working at. There needs to be an understanding as a team as to what those roles are and how they fit into the service that you're providing.
Ultimately, this is all about improving the quality of patient care. Making the most appropriate use of the skills that are in the workforce ensures not only is the quality met, but it's done in a timely manner.
It's usually to do with the registered nurse who's on duty, and the registered nurse has a feeling inside that actually this doesn't feel right to me, therefore you're not allowed to do it. Yet they've been assessed as being competent to do it. And I think one of the things a healthcare assistant can do in a very polite way is to ask the questions of the registered nurse, can you help me to understand? It may be that in the context of care, something may have changed in the process that prevents, in terms of the management of the risk, the environment for the healthcare assistant to be able to undertake that role on that day.
I think safety is always a thing to bear in mind. Am I safe to do this? You might well have been signed off competent, but maybe you're having an off day, maybe something's happened at home before you came to work, maybe you're worried about something, so you just need to reassess and think about the patient's personal safety.
There shouldn't be obstacles to healthcare assistants undertaking duties which they've been trained to do and are deemed as competent. At the end of the day, all this delegation is about what's in the best interest of patients, and delegating is about using the most appropriate resources to provide the highest quality of care to people in the most timely manner.